Hello, it's Kerry Noonan here from the Public Health and Palliative Care Conference. And today I'm very happy to be talking with Claire Turnham. Claire is attending the Public Health and Palliative Care Conference in Bristol for the first time. Is that right, Claire?
It is, yes.
Yeah, for the first time this year in Bristol. Would you want to start by telling us a little bit about the work that you do and the service that you provide in your community?
Sure, thank you. Well, Only with Love is a service which I founded a year ago, and I'm really offering to families and to communities a very gentle funeral service. And in that, I'm able to guide and advocate and work alongside families who wish to care for their own loved ones at home, or who wish to care for them between death and funeral. We're also able to actually guide families to actually arrange the funeral themselves. So it's a very grassroots service, and part of it is education, actually enabling people to understand that they have the right and the responsibility, if they wish to take it, to actually keep their dead at home. Sometimes it is possible as well to work with families where loved ones have died in hospital, and we're able to care for them once they've left the hospital. We can still care for them and to arrange the family funeral as well.
Okay, so you're working both directly with families and with hospices, is that right, and service providers?
Yeah, I mean, I've actually in the last week been working with a family whose loved one died within a hospice of dementia, and she was able to be cared for by her family and by the hospice when she died, and they were able to wash and dress her with guidance. And then actually she gave an incredible gift. She has gifted her brain for research for dementia. So she was taken actually into hospital and had that operation. And then we were again able to guide the family and enable the family to really lead the funeral that they wished for their mother themselves. And they found it a very empowering experience, as many families who actually participate in this level of care. I think birth and death are very similar in that they belong with families. And so it's really my role is to help them in any way that they feel they need it. And often what happens is I may start off by offering and suggesting more services, but actually as they become more empowered or feel more enabled through the process, they step forward and actually are able to care and do more for their loved ones themselves. And so we're dedicated to that particular family, helping them right through the process. So it is really offering continuity of care, and that makes a big difference.
So what was it about the Public Health and Palliative Care Conference that you wanted to connect with? Because you're presenting, aren't you? Presenting a paper.
I am. I'm feeling really proud actually to be presenting, and I'm actually presenting on paying it forward, on how families and communities, when they participate, what can happen. And in my experience, this has been a wonderful, wonderful outcome, is that as families or individuals help care for their own loved ones, they feel simply so empowered by the process that they then feel that they want to help other people. And so that link continues. And this is one of the things that I'm going to be talking about, is actually giving examples of how families have done that. And it's very positive. It is very rich, I think, because it is people just working together as humans in a community in a spirit of community.
Paying it forward. I love that idea.
It's because really the care that we offer is really based just in kindness. It's based in kindness and compassion, and sensitivity. And once people experience that, they feel so that this has such great meaning and such great purpose that they want to tell other people about it. They want to share their experiences. They want to help other people to have similar experiences to them. And I think this is the one thing that unites us all.
Yeah. What are you hoping to get from the conference?
Well, one of the main things I'm really excited about is that there are so many people coming from so many places, and it's just about really listening and learning and finding out what's going on in other communities and how we can translate that to all help each other. I think one of the great things about end-of-life care is actually that we can be there to join everything up, and that actually to be able to offer a seamless service is wonderful. So I'm really excited. I know that there are people coming from all over the world, and they are doing some amazing work. So I'm really looking forward to listening and hearing all about that, and to meeting people. I'm really looking forward to meeting you too, Kerry.
Yeah, me too, very much. It'd be great to find out how we can get in touch with you, and tell us a little bit about your website.
My website is called onlywithlove.co.uk. I also have a Facebook page, which is www.facebook.com/onlywithlove.co.uk. And the website is actually, it's very personal. It's something that I developed myself. It was an incredible labor of love, really, and all the photos on it are very personal. My own story began with the care that I gave to my father. So when he was diagnosed as being terminally ill in 2008, we cared for him in his own home until he died. And, you know, he was so proud of that care that we had given him, and he didn't want anybody else to be caring for him. And so when he died, I really felt at that time that he would have wanted us to continue to care for him at home. And that's what we did. We kept his body at home for 6 days, and he was a gardener, very passionate gardener. And so we held his funeral in his own garden. And this was such a transforming, profound experience for both myself and my children, who were all very actively involved. And now when you look at the website, you will see that the photos that are on there are very personal ones. And I'm really proud as well to be sharing those, because I think that when people see them, hopefully they will gain the same things that I do from them, which is that they are beautiful, they are tender, they are very loving photos of the care that he received. And, you know, my wish is now for other people to experience that as well, and hopefully by their own families. But if they don't feel able to do that, then we can also step in and offer that type of family support ourselves.
Yeah, wonderful. So you're also paying it forward.
Yeah, I think so. I think that this is, I feel that I was given a gift, and it is just really about creating an awareness that this is possible, and it's legal and it's safe and it's very meaningful, and it creates, I think it's very nourishing, and I think it's very helpful in healing. So throughout the grief period, the more that you can be, when people are grieving, the more that they can be actively involved, and realize that it's not a scary experience actually, but it's very natural and very loving and very tender. I think it can only be a good thing.
Yeah, great. Thank you so much. So for everyone out there listening, I guess what I want to say is get onto the Public Health and Palliative Care Conference website, which is phpci.info, and have a look at the conference information. Check out the speakers, see the work, the diverse work that Claire has already talked about today, and yeah, register, get along. It's not too late to register and be part of it. And the other exciting thing is that Mayfest is on in Bristol at the same time, and there are lots of fabulous events, including a death cafe happening in Bristol as part of Mayfest. So it's going to be fun.
I think Bristol is a very exciting city as well. It's a green city, European green city right now, and there's lots of exciting developments going on as well. So I will be really keen to say hello to everyone and to welcome the festival to England. I'm a neighbour of Bristol, really, so yeah, it's all going to be good.
Fantastic. Great. Okay, great.
Thank
Great
you.
chatting with you. Bye.
Okay, bye.